So I hope everyone's having a great afternoon. Great to see you all here. I'm Pamela Gentry, and I am the Deputy Director of the Office of Minority Health. And today we have a great surprise for you, so I want you to hold on to your seatbelts. For those of you who are watching us virtually or who cannot see or see me, I am an African-American female. I have an orange dress and a sailboat pendant. I'm so honored to have you all here today to join us and to highlight all the amazing work that's going on across the healthcare system to sustain health equity in the work that we want to do. Our office is focused on health equity every day and for every person, for every program, and every policy across CMS. If you notice, I have a little red, white, and blue pen on my badge. You may see a few people walking around with those. If you do, say hello to them. They are part of the CMS Office of Minority Health, and they want to say hello to you too. So that's a way for you to identify who we all are. I read an article published in the Journal of Community Medicine a few years ago, and it said that ancient medicine across the globe was different due to vivid cultural and civilization differences. In due course, this was enriched by the integration of cultures across many geographical boundaries, races, and ethnic groups. And due to this, medicine has undergone wide changes, so much that its definition itself has had a metamorphosis many times. What then is medicine? Well, many people think it's a science and others debate that it's an art. But one thing we can all agree on is that it's important to have good practitioners, those who are willing to put the practice for the well-being of all of us. Well, Dr. Aletha Maybank is one of those. We're lucky today because she has joined us in the efforts toward health equity. And to say that she is focused on health equity every day might be an understatement. Speaking today on how this organization has been working with encouraging healthcare systems to disrupt the discourse and to look at structural barriers and efforts towards health equity, we're joined by her today, and you're going to hear her remarks. Dr. Maybank serves as the Chief Health Equity Officer and Senior Vice President of the American Medical Association. I know you know who that is, the good old AMA, where she focuses on embedding health equity across all the work of the AMA and leading its Center for Health Equity. She joined the AMA in April of 2019, as the association's inaugural Chief Health Equity Officer to launch AMA's Center for Health Equity. Prior to this, Dr. Maybank served as the founding Deputy Commissioner for the Center of Health Equity at the New York City Department of Health and Mental Hygiene. It was aimed at strengthening the equity efforts and transforming organizational culture. The center became a model of success recognized by New York City's leadership and the Center for Disease Control and Prevention, as well as the World Health Organization. She was instrumental in infusing equity at a neighborhood level and advancing the department place-based approach to addressing health inequities. She's also set precedents with groundbreaking work in the Office of Minority Health in the Suffolk County Department of Health Services while serving as its founding director. But I'm sure many of you don't need her bio to know her work. You know her from the AMA, from other conferences, from her articles in academic journals, and across healthcare. Her work on diversity, equity, and inclusion, and what that means for those trying to navigate that world. And of course, her focus on health equity within one of the largest names in healthcare. Here today to discuss AMA's strategic plan, their ongoing work, and the actions thus far in advancing health equity, I'm pleased to welcome to stage and to our conference, Dr. Aletha Maybank.
It's quiet. It's so quiet. Right, now put the chair. I don't see a plate here. All right. Good afternoon, everyone. I'm here I didn't know if I was going to make it on time. I don't know if any of you heard. I was sitting in an airplane for about 3.5 hours in New York City. But I'm here, and I'm here safely. Those things used to bother me at some point in time, but now I turned 50 last month. So ever since turning 50, thank you. Ever since turning 50, I'm like, whatever. I'm here. It's such an honor to be here, a pleasure. I thank CMS for the invitation, also for the partnership that we have had over the last couple of years while I've been at the American Medical Association. And I thank many of you in this audience, both here in person, but also virtually. Many of you have been leading this work, this important, critical, necessary, essential, hard and fatiguing at times work of equity and ensuring justice, especially within our institutions. So I'm going to, start this talk here. Okay, and first I'm going to start with the land and labor acknowledgement. This is folks who are familiar with some of the work that we have been trying to put forward at the Center for Health Equity at the American Medical Association, is really acknowledging and centering the voices, the people, the experiences of those who have been most marginalized. And I'm very cautious in doing this at the same time, because I don't think we can be very flippant in just saying we're doing an acknowledgement. You need to be committed to the work as individuals and as institutions, and have actions that actually demonstrate that. And there are always a lot of conflicts to that in terms of institutional actions, because sometimes the values may not fully align or the actions may not fully align. But it is critical, I think, still to center the experiences of those who have been most marginalized. And so we acknowledge that we are all living off the stolen and ancestral lands of Indigenous peoples, which they have cared for since time immemorial. We acknowledge the extraction of brilliance, energy, and life for labor forced upon people of African descent for more than 400 years. And we celebrate the resilience and strength that all Indigenous people and descendants of Africa have shown and continue to show in this country and worldwide. And we carry our ancestors in us, and we continually are called to be better as we lead in this work. And this isn't to say that there aren't clearly in this country many others with many other identities who have not contributed to what the foundations of this country are, and also continually to this day. But it is important to acknowledge in this country who has been most marginalized. So I started this role in 2019. It's been 5 years. April made 5 years. I don't think I would have thought I was going to stay that long. My experience, I'm a startup. I start up organizations within institutions. This is my third time around, and I help support CDC. I'm starting up as well. But a lot has happened in these 5 years, and especially in the 4 years since the public murder of George Floyd, as well as the advent of COVID-19. And this is, I was going through like some old decks, and I hadn't really used this slide in a long time, but it hit me today to use it again. And just to illustrate from a perspective of needing hope, needing to understand and feel that progress has been made of some sort, and that us who we are doing this institutional work, that it does have meaning and it does have value. And so I thought of that when I initially did the slide, and I saw it. I said, well, racism, it's the same context. Many of us, as we were in institutions prior to, prior to 2020, you couldn't walk down the hallway and say racism. Now, I was in a unique experience. My former boss and health commissioner in New York City was Dr. Mary Bassett, who many of you know, and she was very committed, and one of the 4 leaders within this country really naming racism and saying we have to do that as institutions. So we were allowed to walk down New York City Hall saying racism, racism, racism all day long, and not get, in trouble, or folks kind of look at us like, why are you doing that? Or folks being uncomfortable. But when the public murder of George Floyd happened, we know that in this country, there was an open door, and especially for us who have been doing equity work for a long time, recognized that we needed to take advantage of. We needed to figure out how are we going to run through that space as fast as we could, knowing the doors could shut. And that, I think, is the nature and kind of the up and down. I don't think this is not anything new. I think this is how, these doors open, because it's a political environment. That is the reality. Health is political, whether folks want to acknowledge that or not, I think that's very true. And I'll come back to that clearly in a second. And so we've been running, and it reminds me of, when folks say, that this equity work is a marathon, and I usually kind of cringe, against that. And I get the context that it's long-term, that inequities exist, so clearly we got to keep at it. But I don't feel we always have to move at a slow pace. Sometimes we do need to sprint. We have to speed up because of the urgency of the moment. And I know many of us have been sprinting over the last 4 years to get done what we needed to get done. And then sometimes there's the moment to relay, when you have to pass that baton off to somebody else because we're tired, we're exhausted. Maybe somebody else needs to come in and lead this work and lead this effort. And I think this is the legacy of equity and justice work overall within the context of institutions, and especially for us who are working on the inside. And so after that moment 4 years ago, many institutions, I'm sure most of ours in health, put forward some level of a pledge, American Medical Association, not being any different. And I think I was very pleased and surprised all at the same time that they were going to take this position. It is not the position that had been so explicit from the American Medical Association. Most folks have a sense of their history of racial injustice, from excluding Black physicians for over 100 years from being members, as well as being very silent at the point when the debates were going forward and the possibility of desegregating hospitals and the passage of Medicare. AMA was very silent on that. And so we have a racial past, a racial history, a racial injustice history, rather, that, I think ended up being this opportunity that folks on the board of trustees definitely took the opportunity to say, this is the moment, this is a moment of time. We're going to take advantage and put this forward because it's important that we do. And, the other piece that I think is actually critical at that time for myself doing this work, but I also realize being at AMA, the influence that it has had across the health ecosystem are the policies that are listed on the right-hand side. And thanks to the young physicians, the young folks, the med students who put forward these policies to kind of really solidify that I could, and anybody else who is doing work on behalf of AMA and speaking on behalf of AMA could explicitly talk about racism. And not only that, I think the second two policies to me are the most important in terms of driving some of the work that many of y'all have been able to do over the last couple of years around ridding our healthcare system of racial essentialism and making sure we're explicitly naming that race is a social construct, not a biological one, and as well as supporting the elimination of race as a proxy for ancestry, genetics, and biology and medical education, research, and clinical practice. Extremely important policies at that time. Other opportunities that ended up happening during that time, I think that were unique, were, I was able to have these collaborations with leaders like Jonathan Metzl, get papers published in JAMA. I had a piece in an op-ed published in the New York Times. I would never thought that would have ever happened in my lifetime. And I think there was this moment where many Black physicians and physicians who were equity leaders also were able to kind of get this platform at a national level that we never really had before. And so folks wanted to talk with us because of all this exposure of these inequities that must be existing. And the reality is that many of us who are leading these positions do happen to be Black women, not the majority, but many of us tend to be Black women across the country. And so we were getting these opportunities. I got an opportunity to sit across from Oprah virtually. Never thought that would happen. I was nervous even virtually. I feel like that was not my best interview ever. But again, it was this unique space of, how did we push, knowing these doors, we don't get these windows of opportunity, in popular media to put forward the message that we know is absolutely critical that all of our folks need to know. And then the AMA, now, starting to put forward and publish websites that have health equity. And we created a resource center for health equity, which really wasn't present before. Also in the national environment, we know that the nephrologists and the National Kidney Foundation, the Organ Procurement and Transplant Network, worked to eliminate racist corrections for clinical algorithms, as well as other calculations. This is a huge movement, which will have huge outcomes and potential to saving lives. And it's quite significant. And there's still more work and more momentum. And then there's the work of many of you all in CMS in this room, putting forward a framework for health equity. That's a big deal because it's a roadmap for others to follow and pursue in this work. That is a commitment. The Joint Commission putting forward health equity accreditation standards and a health equity certification, NCQA, a health equity accreditation program, and AHRQ publishing a report on the impact of healthcare and the algorithms that they had. So again, to credit to many of you all, in this room as well as in listening in. And there's so much more that I know that has absolutely happened over this particular time. But we also know just as fast as we've been working, there are many others who've been working just as fast to ensure that we don't have rights and that our rights are about to be stripped as much as they can and our democracy is in trouble. And so while we're running, others were running because they understood that what was starting to happen is that we're becoming effective in the work that we're doing. It's meaningful work within institutions. It's not the only work at all in terms of, driving change and structural change within this country. I believe in advocacy and organizing outside of institutions and pushing in that way as a primary point to create change. But it was critical and important, all this work that has been done. And I think sometimes we don't take stock of all the movement that has happened in the last 4 years. It is possible. So when people say to me, we have a marathon, I'm saying, no, we actually have this opportunity to do a lot when we have our minds, our focus, commitments are present, they're visible, we're clear of the vision we're getting towards, we have strategies that are put in place, we can do a lot. And so to speak to that, I'll speak a little bit to some of the work that, we've done at the AMA over the last couple of years and 5 years. And just a foundation for those who don't know much about the American Medical Association. It's a physician advocacy organization around 176 years or 77 years at this point. And our primary foundation and what happened when I came on board, our CEO, Jim Madera, made it very clear that equity was going to be an accelerator of all the work that we did. We have 3 accelerators. One is around advocacy. Advocacy is our very strong kind of role and platform as AMA. Innovation, and then equity was going to be the third. And it was very clear, and he made it very clear to the AMA management team. So I'm on the management team. I work on behalf of the membership. And so we have the management team, the membership, and then we have the House of Delegates, and we have the board. We have there's some level of complexity. It's almost, I think of AMA like Congress in the sense of, that's why they call it the House of Medicine, because it is, they have representation from every single state, a part of the AMA. So that's how they vote. That's how, it's not just one voice. They're not a monolith. It is really by vote on everything that happens. So like those policies that I presented earlier, there was a vote. It wasn't as if everybody, was in support of that, but we had good support and majority support, just to give that as a foundation for AMA. So as I mentioned earlier, those policies provided, this opportunity to put forward a strategic plan. I feel a pretty bold strategic plan, and it's thankfully because of those policies that explicitly talked about racism in the way that it did in doing anti-racism work and the commitment that we were going to have. I also, in that time, was building up a team in order to help support doing this work. I now have a team of 60 people within the AMA Center for Health Equity, which I know is a pretty large team compared to most centers for health equity, offices of minority health across the country. But I really advocated strongly that I don't see how we can do this work if we don't have the people and the capacity as a national organization. Other than that, we're not really committed to, from my perspective, to what we're doing, because investment is absolutely critical to drive the work of equity at an institutional level. So this was the plan. It was 80 pages long. No strategic plan should ever be 80 pages long, really. But what I knew was an opportunity was to provide education. I came from public health. I spent most of my career in governmental public health. Those are my roots. And there was a different, understanding and context, just even generally what creates health and produces health, much more broadly. I come into medicine and there's all this conversation about social determinants of health. And for me, I'm like, well, like, duh, like this is known, like in public health, this is what we study. This is part of what we do. And so there was a lot of there were gaps in knowledge around kind of the foundations of what created health. And then in addition, what is health equity? How do you define health equity? Where do you start? All these gaps that I was just noticing and my team was noticing. So we took time to do educational primers within the context of our strategic plan so that we could help support, hopefully bring people, somewhat to the same space of where we wanted to do. And we had 5 approaches, key approaches. One was embedding equity, so looking inside our institution. I'm a believer you can't do this work unless our own staff and teams, evolve their own mental models and their mindsets on how they understand how they make decisions around the work that they do that potentially could either advance equity or not advance equity. If we don't understand that as the folks who are leading the work and doing the work, then it's really hard and almost impossible to advance equity as an institution. Building alliances, equity and innovation, working upstream. So a lot of, pushing upstream and talking more and teaching physicians more about these upstream considerations. And then looking at pathways to foster truth, reconciliation, and healing. And so I'm not going to go in depth into this because I kind of just said it's pretty intuitive, but the internal work, there have been commitments from we have business units, we call them. They all have to, had to create equity action plans, and they're held accountable for it. And there are just many ways within the institution, beyond just the HR kind of typical DEI approaches of doing the work, but accountability around metrics. And we're now working on a full kind of framework around what are the metrics that we need to have within our institution as AMA that hold us accountable doing the work, but also that we can track change over time. So, this work it's not fast on one level, and on one level it is fast. And I think we all have to be real about this. Not everybody is on board with doing this work internally. And so, there's a lot of work and energy that goes into how do you bring everybody along? How do you bring people along? How do you choose to focus on who's focused? Sometimes, because it can drain you otherwise. So that's our internal work. And then we have done a lot of work around equity and innovation. When I came to, again, AMA from public health, innovation in this sense, in terms of technology and building businesses, that's not how innovation is referred to in public health. Innovation was at the context of diversity and at neighborhood and different voices, and that's how you have innovation, which makes sense to me, truthfully. But innovation was this different space that many of you all are very well aware of. And so I knew that we needed to have some focus in it. And so we actually engaged with people across the country and experts across the country at the intersection of equity and innovation to guide us on what should we do in this space at this beginning point. And so, they said what's really needed is just a basic set of principles around what does it mean to have equitable innovation. And so that's what the Info Health community is about. And so you can find all these things online. But these are really definitely for investors, organizations like yours who are at that, intersection of looking at innovation, engaging with marginalized people, physicians, patients. What is it that you can do to really commit to it? We have a toolkit that now goes along with it. So we've done a lot of work in that space. Our push upstream work is a lot of the work and the bulk of the work that we have done, really working with health systems, as was mentioned earlier, and physicians within those health systems and leveraging our tools and assets as AMA. And one of our biggest assets really is the ability to develop tools as well as convening, which I'll come back to in a second. And so we launched, and so there already exists an AMA educational hub, but within that hub, we've launched a Health Equity Education Center that has lots and lots of modules now on many different topics: LGBTQ, ableism, racism, lots of different topics, quality and safety and how to embed that. And these modules and this education has been actually taken up by we've heard from med schools and residencies as some of their primary forms of tools for the students that they have or the residents that they have. We've also created tools such as embedding equity and crisis preparedness and response in health systems, many partners also engaged in this. This was with support from the Centers for Disease Control and Prevention to create something that was new for health systems. That's something else that I noticed coming from public health. Public health, we kind of lead in our local spaces, the emergency response and preparedness for our cities and communities. Health systems and health, in terms of health care, are a part of it, but they're not typically driving it. And I think there's a lot of difference in understanding of what is the role of a health system in terms of health care and what can they do, what are the actions, what are the structures that they need in place institutionally to drive change, to embed equity. And so we worked with lots of partners to do this particular work here. And you can see also from our graphics, like there's something also to be said about like how things look. I'm a visual person, I'm an artist to some level. And I think using kind of art and visuals to engage is a very critical piece to how we bring people in. We all tend to love some level of arts and visuals. And so we really work to drive that is a key part of our work. So one of the title of this is around, how are we sustaining equity through action? And, there are 3 areas that I'm going to talk about a little bit more in depth. And one is around the narratives, and this is the work that we've been doing. The second is building power as it relates to coalition. And the third is going to be in the context of leading with courage and care. And so the first, this is, to me, our opportunity at this given time, not only within healthcare, but our country, and a need for all of us to understand what are those dominant narratives, malignant narratives, false narratives, whatever term you want to use, that are not working to advance equity within this country and within the systems that we have. I won't read through this because I want to make sure I get through the deck, and I want to respect time because I know I'm a little later than I anticipated. But, you'll have these, but there are all these narratives that are false that we have adopted oftentimes within the context of healthcare that actually do not serve for us to advance equity. So what we did to help support that, or help kind of counter that, I guess I should say, is create a guide, and a guide to language, narrative, and concepts. And this was, again, one of those early tools that I thought was very important, because it's just hard to have conversations about what to do if just foundationally we don't understand these concepts, the history of where and the history and the why of why we are where we are today within the context of this country. And I will say the first 2, so I shared the strategic plan, which is educational, and this one as well, definitely raised the eyebrows of lots of folks. There were folks within medicine, there were folks within AMA that were not fully supportive. And there were, for this particular publication that we put out, there was an article almost in every single major newspaper at that time about, the woke status of AMA. And and it actually, this brought, and folks who are friends with me know that I received death threats from this, and I had to have security detail for about 6 months. And not new to some folks who've been leading this work, especially in this more recent climate. There are several colleagues of mine who have had to have more support in terms of safety because it's threatening to people. And that's when it's threatening to people, you're hitting the narrative work, really hits folks in a way that they know creates power. Because when you challenge the lies that folks have been told, I'll use that term, the power kind of dissipates. And that's fearful for people who are holding on to power. We also worked with, changing narrative as it relates to the visuals that we have. And so the CPT code book that you all are very well aware of, we worked a lot to change these images. And we actually brought in artists again, and artists who are from marginalized communities, Black and Brown artists, people who don't typically get the platform or paid, to do this work. I think that's an important part of this context too. And then we've been convening the National Equity Grand Rounds over the last year and change. This is our next one coming up tomorrow. Is this tomorrow, right? Or is it? Yes, tomorrow. I'm back in New York today, later this evening. But we have Khalil Muhammad on tomorrow. I'm so excited. Ian Hani Lopez. to talk in New York City, and it will be live streamed. But this was our way to really push the conversations in ways that aren't typically pushed within the context of our institutions. And we've been given the space, so I have to, thank, the leadership at AMA for allowing us to do that. But we've had lots of thousands of viewers of those over the last year. So the next is, building and leveraging power via coalition and advocacy. This isn't anything new. I used to teach community organizing in health to master's in public health students when I was, I think, early on deputy commissioner. And I believe in organizing. That is what a lot of this work is we're doing within institutions, right? It's not, we have to organize because we have to get other people on board with what it is we're trying to do in order to create change. And I think a lot of the tools and knowledge that is in organizing is very important, both inside and outside of organizations. And that's really what organized medicine is. It's organizing, right? And sometimes that gets lost, that we are actually, we're doing community organizing in order to push forward policy. We've been working a lot with historically marginalized and minoritized physicians and associations. As I said, we have our history of exclusion and harm. So we work with the National Medical Association, National Hispanic Medical Association, the National Council of Asian Pacific Islander Physicians, the Gay and Lesbian Medical Association, the American Indian Physicians. And so when I say work, I have relationships with everyone, and my team does. We meet on a quarterly basis. We see if there are any programmatic and advocacy priorities that we can align with. And then also, I think it's important that understanding the differences in power as it relates to resources with AMA and these other institutions, we do offer and provide micro grants. They're not large grants, but at least something to help that they can use for the programmatic work that they have in place and they want to do. Another way in which we kind of worked, and we understand that a lot of folks, and you understand this, want to be in community with one another. They want to learn from one another, and we are driven by one another, and they don't want to be in isolation. And so we launched the AMA Peer Network for Advancing Quality and Safety. This was in partnership with Bringers and Women's, as well as the Joint Commission, which we were very honored to have as a partner in this. And they actually still mention this network. We did 1 year as a pilot, and now we're working on creating the impact report. We wanted to see what the impacts were over a given year before we launched another network. But it was, we've received such fantastic feedback from the engagement of these health systems, larger ones across the country, and it wasn't just a commitment of one person. They had to commit around 5 to 6 people at their top level leadership in order to be a part of this. If they did not, they could not be a part of the network, because we didn't want just one person and that burden to happen for one person and not have system-wide change. And so we will be releasing the outcomes of this particular effort a little later this year. Last year, we launched in 2023, Rise to Health Coalition, another opportunity. And we understand that there are a lot, we want to be very careful about not creating a lot of coalitions, because we know there are coalitions. And so what we were hearing from folks was that, there was a lot out there, but they didn't know what was the thing they should follow. What's the right way to do this? There are so many tools. And so we worked with several folks, and I'll go through the partners in a second, to create more of a space in which we actually kind of pull together all the actions and activities that many folks have already been doing, and provide more of a resource that they can kind of, pull from. When you go to the website and you sign on, you can see that there are already a list of actions that were created by the many partners that are involved in this. And so it's not really to kind of replicate or duplicate the wheel or anything of that nature, but just to provide something that, is present, people can build from, but also put folks within the context of community with one another. And all of these, there are 5 pillars, within this, and communities within this. And it's still evolving. It's growing very quickly. There's a lot of interest, and I know there are several folks within this room that are part of this. But there's a journey that we help support organizations and institutions to go through and go on. And then there are all these folks. So IHI, the Institute for Healthcare Improvement, is one of our core partners. And very important to us for accountability purposes is that we have a racial justice organization that also, and we have several, so Race Forward, Groundwater Institute, Health Begins Policy Link, all kind of hold us accountable in our terms of our narrative, ensure that we are actually driving racial equity and racial justice in the work that we do at all times. And then lastly, I would say in terms of, building on that work, because one of the pillars was for organized medicine. And so we just launched last year for the first time a survey to understand better what is organized medicine doing. They are a powerful group of folks, and AMA had part of its power actually comes because they have something called the AMA Federation, and it includes the 150 plus associations with the state medical societies and sometimes the local societies as well. And so we wanted to get a better sense of, just a baseline of what they were doing, and where is it that they needed support, and how can we help support them, as the AMA and as the Center for Health Equity and other partners that exist. And I won't go into detail, but this is just, and I'll share the deck and folks can have this. But, getting grounded to your local history. And this is the baseline data. So this is the first year that we did the results. We just finished another survey. But you can see there are many groups and state associations, some of the societies and associations participating in this, identifying areas for improvement as an example. And this is just the way that we're kind of documenting it. Documenting it and the work and the progress that we're doing. And I think important always is our stories, examples, tools. As we hear from everybody, they need tools, they want tools. And then taking initiative. This is one of my favorites in terms of, I'm doing a lot around kind of, the removal of racist algorithms. And I just think it's an important place where we need to be. It's something that's very tangible to do, but the Medical Society of Delaware actually took active steps to call the labs throughout the state to ensure that they were not correcting for GFR. So I think, it's not easy. It's action, let's put it that way. And it's action that we know works in terms of advancing equity. We also launched a Medical Justice and Advocacy Fellowship for all the reasons, that we need more advocates. We need more physicians that understand advocacy, have the tools, have the connections, and the awareness. Folks ask me whether they have to become an AMA member, and there's no criteria that they need to become an AMA member, but they do get to learn a lot about, and I see Jennifer Brown, who's on the advocacy team, she's sitting right there. They do learn a lot about what is it like to advocate within DC and some of their states, and they're working on local projects. And I think I think all of us need an advocacy kind of education, especially if we're in these environments of institutions, policies. We know we have to interface and be aware of what the politics are around it as well. So the more we can educate, the better. And if you saw that, sorry, let me go back. And that's a partnership with the Satcher Health Leadership Institute that was founded by David Satcher. And so they get to meet Dr. Satcher rather, and engage, with Morehouse. Daniel Dawes was the head of it before. Now he's moved on to Meharry and started something equally as fabulous. So we don't get to work with him as closely, but we still have the partnership that exists. And then another kind of different partnership for AMA, again, coalition building, understanding that we cannot be the ones in terms of the face. We have our histories of some people don't believe us, and our credibility. And so we need to have partners and value people, and institutions have been leading and driving this work for years. And so what we've learned is that this is actually becoming a very good engagement tool for institutions. So we just held our first call with a group of payers to see how we can kind of combine this with some of the quality and safety work that they're doing, and some of the around hypertension specifically, to see if there's a way to kind of leverage and think about that as well. All right. And so the last part is leading with care, and probably the part that is right now on my brain, in the forefront of my brain, and where I, see this work going. I'll come back to that same in a second. So my CEO, Jim Madera, and when I think about, this action that he did, it's one of those courageous actions that he did completely on his own. Nathan Davis is apparently the self-proclaimed father of AMA, as well as the founding editor for JAMA. And when Dr. Madera read these pieces that were co-written by both AMA and NMA, the National Medical Association, that was started because Black physicians were excluded from AMA, he was shocked. He didn't know the history. He had been on board for a little while, but he had never read these pieces, and he never realized kind of the direct connection, the explicit nature of Nathan Davis as it related to the exclusion of Black physicians. So I remember getting the email, and he had already asked for the bus to be removed. I was shocked, kind of looking at my computer like, wow, he did this on his own. And he did this on his own after, listening, hearing people, doing trainings. Trainings aren't enough. We know that alone, but they are important, and they do help depending on what kind of trainings they are. And so, he had gotten to the point of doing his own work, and he made this courageous decision that not everybody would do, but to ask it to go into the archives. And then the board followed up and said that we weren't going to, have other awards named after him. But that's just one example. And those examples are important for us who are in institutions doing this work, because we want to believe in our leaders. We want to believe that they are also too committed to doing this, and we want to believe that they're committed to doing without us having to say anything for them to make that change and to have the will to do something differently and to do something better. This is Alan Nelson. So how many people have heard of unequal treatment? I imagine the majority of us who have been in the equity space, disparity space for a long time, right? It was an important document for all of us. I didn't know this before coming on to AMA, so I knew the other co-editor, and many of you have heard of Brian Smedley. And Brian Smedley is a friend of mine, and we worked together on several projects. But when I came to AMA and learned who Alan Nelson was, he was former president. So that really, that surprised me. Now I understand it as I learned more about the history. It's good positioning, to have the head of the AMA as part of this document. But he talks about how, initially he wasn't quite a believer, in this context of disparities. But after looking through all the evidence and the research, the literature reviews, he completely evolved. And he even, I think, his reflection that's kind of written here, to me, it's really telling that, sorry, 1 second. It's really telling that, folks can think, and he got the sense that folks could think they're doing the right thing and that they're in the right space, but he realized that that's just not the case. And there are many people who still had a lot of work to do, but didn't want to admit that they needed the work to do. And so I always thought that, that's a profound place. And I think it's a place where we're still at to this day. It's that context of how do we move beyond just the language and the words of it. What does it really mean to sustain action? What is the will that we need to have in order to do that and to possess that is absolutely critical for as many of us, and some of us, a lot of us. It's not a hard thing. This is very personal to me. If anybody says these things, I saw that color change. I was like, what happened? Like the light bright change. But this is personal to me. It is. I'm Black. I'm a woman, and my family, my community, we are dying earlier, and that's a story for many other people, for other identities as well. So if anybody says, don't take it personally, I said, I absolutely will, because it is. And so, this context of like, how do we care? At this point in time, David Satcher, he recently has a book that was published by Quest for Health Equity. It says we need leaders first who care enough, we need leaders who learn enough, we need leaders who do enough. And I'm no longer at the point where I don't feel it's data that moves us. Once you're somebody who's kind of signed on board, and yes, we need to advance equity. I believe in it. I'm committed to it. I'm going to do better. We need to do better. Data will definitely move us, right? And you will follow the numbers. We will hold ourselves accountable to the numbers. We need that. But I don't feel that is the beginning point of change. I don't think that that's where will happens from. And what I've learned being, especially in the last 5 years, is that the context of how kind of proximate, how vulnerable, how much I share my story, how open somebody is to allow you to share their story and vice versa, to hear something differently, to feel something differently, that's the point of which change happens. That's the point of where somebody says and wills differently. This is all this work that we're doing. It's not rocket science. It's just not. The disparities and the differences are there. We have a lot of technology. We have a lot of, expertise and excellence within this country. We can figure it out. There are a lot of things we figure out very quickly, easy. We can do this. But this, to me, the gap is will. And if people really, I talk about being a good human now, that this is the work of being a good human. And folks may or may not like this context, but it's just kind of where I'm at. It's not even just in the institutional climate. It's in our national climate. It's in our global climate for me. And, the context of valuing all people equally, Kamara Jones talks a lot about this, is the important context of what equity means. And our data shows us we do not value all people equally. That's just the bottom line of it. If your institutional data has disparities and inequities, we don't value people equally. And it's not about the intention. I don't think we know there are. But there aren't, most of us in this room and in this audience have good intention, and we want to see things happen. We want to see things happen well and for people to have equitable experiences and opportunities. But the impact is what's critical. What are the outcomes showing of the decisions that we are making as institutions and as individuals? What's the will that's going to change, that's going to allow you to do something differently, to allow you to hear something differently? That's the point of where we're at. Knowing our history, harboring humility, always knowing, what you don't know is what you don't know. Seeing the humanity, all these things that, of course. But what I realize on a day-to-day basis, not everybody has this context, this positioning of what it means to be a human, being proximate, being close to one another. Brian Stevenson talks a lot about this, that, we move and shift at the point of proximity. And so to me, equity is a moral condition, clearly has business impacts and outcomes and all of those. That's clear. But it's a moral condition primarily. And we're either saying we should have it or we shouldn't have it. Either we value people equally or we don't value people equally. And I like to get to the simplicity sometimes of that, because then folks will want me to lose focus on something else that I don't feel we should be losing focus on. This is about the bottom line of everybody having the optimal opportunity to achieve optimal health. That's it. And so many folks know I wrote this piece in the New England Journal, who was the only one who said yes to publishing it. That was eye-opening too, because of what I said in the beginning, where before a lot of what I was writing, would get published. But this definitely hit people in a different way, because there are so many interpretations around what I wrote that could have been taken. But what's important for me about this piece was that I needed to, control my own narrative doing this work as a woman, as a physician, a Black woman in an institution. And I've always been doing this work in institutions. But I also wanted, very importantly, in my first form of this was a love letter to other equity colleagues, and saying that I see you and that I feel you. I completely understand what you're going through at this time, the hardness, the toll, the exhaustion, the impacts that are happening on our health, the refusal of people to, within our institutions to kind of work with us, even when we want to work together. It's a very frustrating and taxing time right now for us and for many people across the world. But I felt it was important that, we share it. And one of the statements that I said in the love letter was, my hope for us is that we keep finding and sharing and expressing joy along with all the other emotions and ways of being necessary to fight, disrupt, and dismantle oppressive structures, conditions, and people to realize the experience of freedom, justice, liberation, and joy, and not just in spurts, but consistently. And I think, I always talk about, one of my friends said to me during COVID, Always remember, and I went for music therapy during COVID because I needed something. And he said to me, you always come in and you're talking about the freedom, and the justice you're fighting for, but always remember that our ancestors were also fighting for our joy and for our rest, and for me to go out and to find it. And it's hard, the context and the conditions of so many people within this country and across the world aren't allowing for these opportunities. So it's a hard and at times to feel that comfort and to feel that freedom, to have joy and to have rest. But I think it's important and critical for us to claim it, and that it's different for everybody. That's the other thing. It's not judging the decisions that other people make for what they need to do for themselves. That is what I'm learning at this time. When your time is done, your time is done. When you can't do this work any longer, you can't do this work any longer. And that's a commitment that you have to make, and we all have to make for ourselves. And it reminds me, again, I'm almost done here. Sorry, I didn't know I was going to even talk this much. Maybe I did, but Fannie Lou Hamer. So when I left the health department in New York City, when my gift from my team was, they had this subway poster series, apparently from the 60s, of Fannie Lou Hamer, and she was giving a speech. And so they got one of the original posters and all signed around it and framed it. And so this is like the quote that was on it. And it's the one that sticks with me the most, of just being sick and tired of being sick and tired, and, we talk about the marathon, we talk about the sprints. And it's at the moment of time where, right now, it's for me to be quite vulnerable and honest, is just finding and figuring out what that hopeful piece is, to keep doing this. And Fannie Lou Hamer, it's not that hard on one level, because this to me is just part of the legacy that's been passed down, and that, this is the path that, many of us are on, to continue the fight for freedom, justice, and liberation. And there's no question to it. There's an obligation to it. And there's a belief, clearly, we have progressed. As I said, in the 4 years that I mentioned at the beginning of this, that we have done a lot collectively. We've done a lot individually. And we have to remember that. We have to remember that during this time. We have to keep together, operate in greater solidarity. I think we have a harder time doing that. We say we do, but we don't fully do it. And so I think, and this is my last slide, this is a Isabel Wilkerson's cast, Ava DuVernay, just, last year or earlier this year, released, a film, Origins, that was kind of an adaptation of it. But this is the quote that I use, quite frequently, because the reality, and as a Black and brown person, as a person of color, a lot of this work tends to rest on our shoulders, and we're looked upon as the ones who need to talk about it, need to lead it. And I don't feel like that's the case at all. We can't do that. All of us need to have this will and this courage to speak up in ways that, we may not be used to or comfortable with, to communicate with people, be proximate with people that we usually aren't proximate with. Our country's set up in ways that we're very distant. When we go home, we tend to be highly segregated. But how do we kind of break through that so that we can learn about people, feel somebody else's humanity? Because that's the only point, and only point of which we actually change and we develop different wills. So, I thank you all, for listening to me. I thank you all for the work that you are doing. And, I wish you much hope, much courage, much joy, much rest, as we still have to continue our fights, our work, our collective work, our success, and sometimes our failures, but we continue to persist forward for the pursuit of justice for all people within this country and this world. Thank you.
Thank you, Dr. Maybank. I'm inspired. I'm sure you are, and excited to hear all the commitment that the AMA has made in sustaining health equity and working with all of us here in this room. I know our audience is touched by the acknowledgement and the recognition of the past actions and how examining those and looking at the structural issues can lead us forward in making change. And that's exactly what we're hoping to continue to see out of this conference, lasting, sustainable actions toward health equity. So it's time for you all now to get a short break, but we need to keep this momentum going. So this afternoon, we'll have breakout sessions, and we'll hear from our Innovation Center at CMS about our model participations. The Center for Medicare will be here, and our quality team. That's all in this room if you choose that breakout session. And we have exciting lightning talks, language needs, territories, and data work. Take a break and come back here to this room if you're interested in that particular session. Check out your agenda to learn the rooms and where the sessions are located and available. And don't forget the poster hall exhibits and the networking hour at the end of the day. And please note, for those of you in person, you have a chance to talk to the authors of the posters. And for those joining us virtually, you can view the posters online or take time to visit our exhibit booths, all available online, and there's a featured chat option for those of you joining us virtually, or just simply view all of them. So go ahead, enjoy your break, and some of you will see right back here. Thank you.